So, good evening, Tracy. How are you doing today?
I'm finding yourself.
I'm doing pretty good. Um, so for this session today, I'm just want to get your input on the reason why we're here today.
Well, wait a minute. How did you know my name?
Remember when we met the other day, and you wanted to have a session just to see a treatment plan or how we can progress and see um
Yes,
how can
we
you do?
we we yes, we remember. We remember. I remember now. I remember you now.
Okay, okay. I heard you say we. Who, who do you mean by we?
I'm
Okay,
I'm here.
okay. All
Do you
right.
mind if do you mind if I take notes? I need to take notes because I need to remember everything that you're saying.
Sure, go right ahead. I do not mind. So I know in our first initial intake meeting, we didn't really get to answer a lot of questions, or I didn't get to ask a lot of questions. So are you currently taking any medications?
Yes.
And do you know what medications those are?
Mm-hmm. I take Lamictal and um I'm I don't really like how the Lamictal makes me feel sometimes.
Okay.
Um, and I take Zyprexa. I used to take lithium, but
Mm-hmm.
I they used to have to make me come in to take my blood. I didn't like them taking my blood,
Got,
so
got it.
um, we stopped taking that.
Okay. And those are the only medications you're taking currently right now?
Yes.
Okay. Which ones do you think that's working the best for you?
I guess if I have to choose one, I'm gonna say the Zyprexa. Um, it normally works, but so far it hasn't been working so good. These last couple of, I guess, months, um, because I can hear the people talking.
Okay, got it. Um, so when you say you hear those people talking, like, is that affecting your sleep? Like, you having any trouble sleeping?
Yeah, I'm not I don't go to sleep. I have to stay up because if I don't stay up, they gonna catch me slipping. I took their drugs, and I don't have the money to give them, and I don't have the drugs to give them back. So I need to be able to hear. They tell me when someone's coming, and then I'm able to, leave my house and go somewhere real quick so that they don't find me.
Who are you afraid of when you say you're scared of them finding you?
So I was supposed to be a drug mule for the drug cartel in Camden, and someone came up to me and they found me and they asked me to take the drugs and go take them to Burlington County, and I said yes. And but then I ended up taking the drugs and using them myself, and so they've been trying to find me. I had to move because they were looking for me.
Hmm.
I know they're looking for me. I think my neighbors are, telling them where I live. So,
Hmm.
sometimes I go and I stay with friends, and then sometimes, because I don't want them coming after my friends, then, I go ahead and I leave my friends, and then I try to just make sure that they can't find me. You know, I change my number, and I keep having burner phones so that I don't ever have the same phone.
Got it. Um, so if you're living in fear right now, do you have anywhere like safe that you can stay or any place that you feel safe at?
Sometimes I go to the library because they got a lot of books at the library, and I'm able to like look up all the different things that like I really need, you know. Um I try to find different ways of, getting stuff done. So at the library, there's like a lot of books and there's maps, and I can look up all these different places to go to.
Okay, got it. Um, so after just hearing a little bit of like what you got going on in your background, so what do you feel like you want to get out of this session?
Right now, I need for Tony and I need for Gino to stop talking to me. Um, right now, it's too much. Like, that's why I have my headphones, because it sometimes it like quiets them. I can't hear them, and so I try to use them, especially during the day. But at night, I need to have them because I have to take them off, because I need them to be able to like let me know when someone's coming for us.
Got it. Okay,
No, he's
so
trying to help. No, I think he's trying to help us.
who are you talking to right now?
Oh, Tony's telling me not to trust you.
Okay. Well, you can trust me. This is right here is just a safe place where you can talk and discuss anything that you want to. So, um, like I said, after hearing some of your background and things like that, I was hoping we can come in for you to have a weekly session with me, and then we can discuss a plan how you can um deal with everything that you're going through right now.
Now, let me ask you, you're not going to try to say that I have to go into the hospital, right? Because I'm not going into the hospital, because every time I go to the hospital, they keep me there for a long time, and then I have to take like all of these medicines, and I think that the medicines I have, they're working. I just, maybe they just need to be changed a little bit, or increased a little bit, but I don't want to go into the hospital.
No, 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 you're not be going to the hospital the same way we meeting right here, where we sitting and talking. We just do that every week normally at a certain time, whatever time fits your schedule, and then how we will work.
Now, you said meet with you weekly. How long are these sessions going to be?
They could be anywhere between an hour, hour and a half or so.
And they're always going to be here at your office?
Yes.
And tell me your name again, please.
My name is Matthew.
Sometimes I wish that I had, some friends. I used to have some friends, but they got sick of me, and all the times that, I had to go to the hospital. And then, once I told them about the drug people coming after me, they didn't want to be around, because sometimes it gets lonely to
Mm.
not have people that you can talk to, sometimes. But it's okay, because like I said, I go to the library and I read books, and I'm able to kind of map out things that I need to do, and I'm able to keep putting stuff in my books, in my
Yeah,
notebook.
and that's perfectly fine. We're gonna continue these sessions and to help you better communicate, and you can able to build relationships with those current friends or maybe new friends that you have and work it out like that.
Are you gonna be able to fix my meds?
Yes, we can do that. Yeah.
Are you gonna do that today?
Yes, if you have time, we can do that.
Okay.
Okay. And we can do that right now if you want.
Okay, so I am going to let me figure out